My name is Dr. Kaitlyn Iselborn. I am a doctor of physical therapy at Iselborn Chiropractic and Physical Therapy and Sports Recovery Annex. So as far as back pain goes, the numbers really are astonishing as far as the number of people walking around with a herniated disc, and a lot of them don't even know about it. We have this inner portion of the disc that is the nucleus pulposus. Then we have the outer portion of the disc that is the annulus fibrosus. So whenever we herniate a disc, usually what that means is that the nucleus is kind of starting to encroach upon that annulus. So different ways that we can injure our disc. So honestly, the most common way is going to be where we have this flexion motion and when we're twisting rotation. So when we're bending over at the spine and then we're twisting. When that happens, those annular fibers in that outer portion of the disc, only 50% of those fibers are working when we're bent over and we're twisting. Now if we add a load to it, so say you're bending over and picking up a boulder or some pavers or whatever, you're doing yard work, you're picking a bag of mulch. So now you're bending over, twisting, picking up a load. Now your body's kind of at that most susceptible, most at-risk position for having any sort of disc injury. Our lumbar spine is the most susceptible to disc injuries. The reason why lumbar spine is most at risk for injuries of the disc is because the nucleus, that inner portion of the disc, is located a little more to the back of the disc itself rather than in the thoracic and the cervical spine where the nucleus is kind of more centrally located. Discs can heal. Discs are innervated, meaning they have nerve and blood supply, meaning they can heal depending on the severity of it. Typically a disc, I would say probably around like 6 months if it's kind of a chronic ongoing issue. So it's not a quick fix. But they can heal. So typically treatment, we want to take pressure off of the site and off of the disc itself, but we want to stabilize the area. We want to increase mobility of the spine. We want to strengthen the structures around it to take that pressure off the spine. We have different phases of a disc injury. So a lot of times if we get a patient like immediately after they've had a disc injury like that and they've had a herniation, we try and put them in this protective extension. So we try and arch the back a little bit, and we can do that by using things like bracing, using some taping, stuff like that to put them in this extension so that we prevent that space that I was talking about earlier, how when we flex, we open up the spine. We don't want that spine to open up anymore. So we want to put them kind of in a little bit of extension to prevent that disc from going out anymore. But again, treatment-wise, after doing that, we really want to focus on strengthening the surrounding muscles. We want to mobilize the joints that have become really stiff from guarding the specific segment. So different treatment techniques, different manual techniques and strengthening techniques, endurance-wise, to kind of take the reactivity level down a bit now, but also prevent it from getting worse and heal it.